Hi, good evening, and welcome to the Caribbean Parenting Digital Special Feature Edition. And of course, you're viewing part of our public education series right here on Caribbean Parenting, where, of course, we continue to use the platform to have conversations that give helpful tips about how to be a better parent each day. And as if you've been following us today, you would know that, we've really been taking time to observe World Mental Health Day. And we know that it is observed every 10th of October with the aim to raise awareness of mental health issues around the world and to mobilize efforts in support of mental health. In this particular discussion, what we want to do is to unearth and understand the mental health and its impact on the elderly and how it can be treated with. So we're going to be doing this discussion this evening with Dr. Jennifer Rouse, who is a gerontologist by profession and a part-time lecturer at the University of the West Indies. So even now, we want to welcome Dr. Rouse to our public education series. Hi again, Dr. Rouse.
Good evening, good afternoon to you.
Yes, I mean, it's a pleasure. I'm excited to have you here, even as we chat about mental health and the elderly. And even as we get into this discussion, off camera, you were mentioning statistics. And I just kind of maybe wanted to pivot from there and ask you, when it comes to mental health statistics, whether you would refer to it locally or within the region, what is the prevalence of mental health among the elderly in general? And if you could share among the elderly so that the viewing audience could understand what the mental health experience is like for the elderly.
Good afternoon to everyone and to our viewers, listeners. It is good that you asked that question at this time because earlier today, this afternoon, as a matter of fact, our Honorable Prime Minister hosted a press conference on the whole COVID experience, and he had with him the Chief Medical Officer and the Minister of Health. And that question was posed in the context, because he did speak about Mental Health Awareness Day, and he had to, the CMO had to say that the data is not disaggregated yet in terms of the target group that we are here mentioning about the elderly. But what he did say, which was an eye-opener for me, is that in Trinidad and Tobago's population of 1.4 million, there's noticing, especially through COVID, that mental health and illness is on the rise. Yeah. And now it is speculated it's like 1 in every 4. That's a lot.
Yeah.
So we know, and so what I did when I heard that, what I do know with the statistics of our aging population, because Trinidad and Tobago is an aging population, and an aging population is when 10% or more of your total population is over 60. 60 is the baseline age that the United Nations uses.
Yeah.
At the last census, which was done in 2010, because the census is done every 10 years.
Yes.
That stated where we were 13.4%, which in numbers was about 177,676 persons aged 60 and over. But because it is projected that by 2030, we should be, in our seniors alone, we should be now 17.5%. And COVID having come in 2020, which is the year we should have held a census.
Yes.
We couldn't afford to have field officers going out to collect data.
That's right.
So I just kind of made a guesstimate that if we were 13.4 at 2010, then to make it to 17.5 by 2030, if we used a 5-year range to add on 1%, then between 2010 and 15, we would have been 14.4. And by 2020, we would be 15.4.
Yes.
That is roughly about 215,000 people.
Yes.
Age 60 and over. So if even you want to say 1 in every 4.
Yes.
You see how I did it? So that is alarming. And so that to give you a kind of circuitous response, but that is how I arrived at what we are really looking at.
Right, but you spoke generally about the broad perspective of that 1 in 4 guesstimate. But
Sure.
one of the things I wanted to ask you, when we start thinking about mental health problems, especially mental health problems among the elderly, what
Mhm.
exactly is it that we're talking about? Because we can imagine the person on the street might be thinking, my grandmother just miserable, or
Right.
my grandfather just like to give trouble. But when we're
Correct.
talking about mental health problems, what
Sure.
are we really talking
Really
about?
speaking
What are
about.
those things? What are we looking at? What is the
Correct.
everyday experience that we
Sure.
could start to factor to refer to as a mental health problem among an elderly person?
What we have noticed, and this was during my tenure as director of the Division of Aging, which is where I was the last time, you have to notice that their accustomed behavior
Mm-hmm.
changes.
Mm.
Um, Now, don't mistake depression necessarily with mental illness, but it's a kind of a precursor to where they could be heading if an intervention is needed. Intervention
Right.
with medication, or an intervention with a caregiver or somebody recognizing, wait a minute, this not my mom was a very lively, effervescent person, interested in worldview and things, going out and doing what she has to do. And now she's just sitting home, hardly speaking, sometimes just staring at the TV, and you know that the TV is looking at her. And if
Mm-hmm.
you had to interrupt and say, Mom, what you're looking at, she can't tell you.
Right.
Just there. Those are some of the little cues that you take, as well as now you have those who start asking you the same thing over and over. You just told them
Mm.
and you're going about your way, and you hear say, what about so? You say, but I just told you. At first you start off saying, but you remember I just told you. By the time the fourth time that come around, your voice going up about an octave or two. And that's where the
Yes.
miserableness.
Yes.
But I'm telling you that, you see? Now,
Mm-hmm.
in a COVID environment, the household is under stress. We talking
Yes.
the average, because here you have, you're not alone, you are a homemaker, you could
Yes.
be a young couple with 2 young children,
Mm.
2 young children having homeschool. You might be working at home, husband is one of the essential workers,
Yes.
or vice versa.
Yes.
Then here is matriarch or granny who might fortunately be in the household.
Yes.
And you also have where the mother or parents, which would be the grandparents of the little children, they could be living alone elsewhere.
Yes.
But you are noticing for those who have to visit the parent, which is an elder, it is now visiting has cut down.
Mm-hmm.
Even if they visit, they have to stay outside and maybe
Yes.
driveway and talk
Because
to
we
them,
need physical distancing. Yes.
see whether they're in a mask or not. And
Yes.
that now will begin to plant the seeds of loneliness and
Mm.
confusion. Because this is where the onus rests with that adult child to explain beforehand, depending on how old this parent is. Because the young old,
Yeah.
everybody always laughs when I tell them there's 3 social constructs in the whole aging range.
Right.
Those aged 60 to 74 are the
Mm-hmm.
young old.
Right.
75 to 84 are the old. I
Yeah.
get you laughing too. And then 85 and over are considered the oldest old. And this
Right.
construct is just for policymakers, and which is the government.
Yes.
Policymakers and policy development, so that when they have to distribute resources, they
Yes.
know the numbers that are the oldest old, because they tend to be the more infirm.
Yes,
Those
but
who are the
Dr. Rouse, I'm so happy to have you mention this because I don't think the average person classifies it in that
No,
way.
you're just
But
old.
if we were to understand it, we wouldn't just
Correct.
look at, let's say, our parents or grandparents as old,
Right.
but we could
Exactly.
think about them in context, because like you talk about what's happening with COVID and schooling and so on, then
Yes.
maybe if we realize they're in the oldest of the old, we
Correct.
might need to pull back and not try to get them to say, okay, Granny, I needed to babysit today. That might be such a good idea. Granny
Precisely.
can handle that right now.
Precisely.
So I think it's an important. Thank you for
Yes,
sharing
it
that.
is very, and
Definitely.
you see, I'm glad you made that connection because people always treat it as a joke, as if, well, you're fighting to stay in the first cohort of the young old. No, it's not. It has nothing to do with that. And as a matter of fact, even among some of the older persons, this is from 60 and up,
Yes.
you back in the day when it wasn't, when we were COVID free and we had functions, you would hear some of them in some of the functions. He says, Dr. Rouse, why you bring me here with these old people? That's because you have
Yes.
the 74 with the 85s and over, and they're like, I ain't reached there
Yes.
yet. You follow? So
Yes, yes,
one
yes,
of those,
definitely.
and
But even as we continue the discussion, what are the
yeah,
factors? I know you mentioned that loneliness that would have come because of
loneliness.
COVID,
Yes.
and you mentioned those. But can you share with us, are there, what other factors are there that contribute to mental health problems among our elderly citizens?
Now, one of the things, and I will only use it as a segue, as you reminded me of the loneliness. Dr. Joan Rollins had done a study over here on
Right.
a survey of living conditions among the older persons. And she did it among about 546, I think, informants. And 16% of that number lived in households with family, and they complained of being lonely.
Wow.
So here I have to say this because people think loneliness is being alone.
Mm.
No, it isn't. So it means that the way households are operating, busy, 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 busy,
Yes.
not take, they always tell you young mothers could give you every nuance of that baby. If,
Yes.
if it's not waking up at a, you follow? That
Yes.
same kind of monitoring is almost needed when you are now in your older years,
Wow.
especially over 75, 80.
Yeah.
They're not eating the food. They are not interested in the things that used to interest them. That's the
Mm.
first signs of pulling back. And they
Right.
go into this sort of hole. Now, we go back to that statistics of, let us say, 1 in every 4. How you know? What is the trigger? Now,
Mm-hmm.
there's also the element that when you have things like schizophrenia and bipolar, some of it is hereditary.
Right.
It could be genetic. You see? So it means that it is incumbent to understand when you see mommy or daddy acting strangely, like she will
Mm-hmm.
just go out and shop, spend her whole pension a day in just buying things she may not need. Comes
Yeah.
home with a very excitable, a kind of frenetic energy. And
Yes.
then when it wears off, because you don't know what it is yet, wears off, she goes
Mm-hmm.
into this
Yes.
depression. You follow? That's the two
Yes.
extremes. But
Mm-hmm.
with regard the elderly now, the 60 and over, the more prevalent aspect of mental illness is dementia,
Mm.
of which there are derivatives. So, under the heading of dementia is the most popular one, Alzheimer's disease, because
Right.
people use the term Alzheimer's and dementia interchangeably, but dementia is the overarching mental illness and
Yes.
has variants. Good. So,
Yes.
we are seeing an increase commensurate with the rate at which people are aging, or let
Mm.
us call it retiring, because your retirement age most times in the Caribbean is age 60. And
Right.
United Nations did predict this. They said the rate at which the world is aging, commensurate with that, will come elder abuse. And one of the ways in which persons abuse the elderly is when they do not understand the
Yes.
early signs of dementia and
Yeah.
Alzheimer's. So your
Yes.
mom could be, and it is not gender based, as you know.
Yes.
So you will see strange things like they don't want to bathe. Now, a lot of seniors who are the very old, the oldest old, because
Yes.
their skin becomes so very, very thin and wrinkled,
Mhm.
they can't have, there must be no set of friction because it hurts them. So they
Right.
feel cold and hot different to us.
Right.
So when you hear very, very old telling you, I don't want to bathe, that is not mental illness. That is
Yes.
part of coming with them at that age. So what you have to give them almost is you take wipes and wipe
Mm.
them very gently. Now the ones who are in the young old and going into the oldest old, so those between 60 and let us say 75, those are the ones who are supposed to be up and about, going
Yes.
about their business. But we are seeing a different element now. Some did not prepare mentally
For that.
for old age. They have some now. I would ask it almost in question because of my experience. The gender aspect of it here, especially among the men. Some of them, when they retire, keep going back to their office. They dress for work. They take the public transport or whatever. And some of them, depending on the security at that building, they may line with the guard whole day. It means at a psychological level, they have not adjusted or
Yes.
required to being on their own and adapting or
Mm-hmm.
changing what activities they used to have to replace them with new ones. And
Right.
a lot of seniors that get difficulty with that. It's almost
Right.
like telling them you're starting to relearn and retool
Mm-hmm.
all over. Some of them are intimidated by the Zoom and virtual
Yes.
because we in the Caribbean are very sensate, very
Mm-hmm.
tactile,
Yes.
like to hug you. You remember the tune, How Long I Ain't See You,
Yes.
and pinch your cheeks and whatever.
That's
So when all
right.
of that is now imposed, it's an imposition where you are not to do it because of your very life. Your life now depends on it. That's where you're going to begin seeing the signs where they're not attending to what you call the activities of daily living, just
I,
the basic hygiene.
yeah.
And you follow? And
Yes.
one last thing we need to be clear on, and this is what the population needs to understand, and
Mm.
it is right through the Caribbean. Most of our seniors, almost 98 to 99%, live in the community. We are not a culture of institutionalizing our seniors.
Yes.
Even though Trinidad has between 169 to 194 homes for the aged, that is only 0.1%.
Yes.
So it means if you were in an institution where you had inspectors coming in and persons who monitor in, you
Yes.
might have stood a better chance to detect and get numbers of how
Yes.
many in the institutions are suffering with mental illness.
Yeah.
But in the
Because you're
community,
in the
remember, you
home.
can't, no, and you can't just go into a private domicile. So
Yes.
those are
Yes.
the things that kind of make it kind of spurious when you have to come up with numbers.
And this is why I think conversations like these are so important so that people within the homes can be exposed and they can learn. But even Dr. Ross, before we get into chatting about how we could better support, you want to just take a pause for a quick minute and just give some appreciation and highlight Victoria Literacy Center. They are the sponsor for the production of today's program, and they do have support that they're highlighting today regarding their Form 1 prep program as they celebrate those that have received the SCA results. So we're just going to take a pause for one moment as we take a word from our sponsor.
Sure.
And as we continue with our conversation, of course,
Yeah.
for those of you viewing live and those who will be on the replay, we are here at Caribbean Parenting Public Education Series with Dr. Jennifer Rouse as we're chatting and celebrating World Mental Health Day, giving focus to mental health and the elderly. And as we continue our conversation, we're talking about measures that we can use to take care of the elderly, especially those with mental health problems. And Dr. Rouse, I'm really interested. I know you mentioned, for example, of where you find older persons they may not want to take a bath, and it's because
So,
their skin is now so sensitive. So using the wet wipes and other little things like that can make such a difference. But
yeah.
can you take a moment to share with us about what the population should understand about what they can do within the home, and also what institutions, whether governmental, NGO, or otherwise, that are available, that if you feel like you have, an elderly person, you're not coping well to support, but you mean well, you don't want to cause elderly abuse, who can you reach out to? If you could share a bit on that for us, please.
To take the last question first, because of the freshness of it. And I say
Sure.
this because I only got the information yesterday
Right.
that there's the GAP program, the Geriatric Adolescent Partnership Program, which
Okay.
housed in the Ministry of Social Development where I was. But I
Mm-hmm.
didn't know in this new incarnation, it is now under the Ministry of Youth and Development and National Service. You
Okay.
got So I only learned that yesterday, so I'm sharing it with you now.
Sharing. Thank you.
Um, they have to kind of reconstruct it, and that's the stage they're going through. But for the general public and listeners, they can call the Ministry of Social Development still, because physically they are still housed there. And the
Yeah.
number, if you wish, is 623-2608. That's the PBX number. And you can then ask for the either the Division of Aging or the GAP program. Good? And they will
Okay.
let you know.
Yes.
If there is abuse happening and some neighbor or somebody detects that something is going on, they can also call the police unit called the Victim and Support Unit.
Okay.
Because the police can enter home, the Division of Aging and the family. So we can't just go into the home. We would still have to be accompanied by a community police, by the community police. You understand?
Yes.
So, but at least we trying to focus now on what can we do, the action.
Yes.
What we also notice with the seniors, who we must not exclude them. When you're going back to your first question, they need to be part of the family.
Yes.
Keep them included. Now, they are the new seniors, and I call them which are the baby boomers. I am an
Yes.
honorary member. The United Nations already said, when you want to know how to plan and what to do with older persons, speak to the older persons themselves.
Yes.
Because you might be saying, oh Lord, look how granny dear. You don't know granny want to be alone. You are, you are thinking through your lens.
That's right.
Oh Lord, poor granny. Speak to granny. Granny, would you like me to call you? Because the new seniors have
Mm-hmm.
call waiting, caller ID, and some in the gym, or they are the spa.
It's true.
They are
Yes.
the spa. Now I'm saying this in a context
Mm-hmm.
because this helps some of them to keep Okura and to keep included in all that is going on.
Yes.
If you were one that are accustomed being in the gym, and I even spoke to some of the gyms, not in COVID, but before,
Mm-hmm.
these are the hours the seniors prefer, 4 in the morning. That's how gyms are
Yes.
24 hours, 4 in the morning before
Yes.
the posers come.
Mm-hmm.
The seniors do have to do spin and all these things.
Yes.
Also, what I was pleased about, under my tenure, we had established a senior activity centers program.
Okay.
it was the bomb. But I mean, when funds started to get involved,
Yes.
that was a.
Yes.
But I heard yesterday, Monday in the no yesterday in the budget debate, we have five again, and I'm
Right.
saying this to the seniors, senior activity centers. Call the division of aging. They will refer you to where these centers are. These are educational and recreational places where they go on outings. They have presenters that come to the center to give them lectures on topical issues they want, including like the one you're doing now. They also
Yes.
do batik, they do art, they do soft furnishings, because you remember the Ministry of Community Development has all these programs free. So they
Yes.
bring them to the centers. Some of them do kitchen gardens, and they have students from the university that do internships with them. Because
Good.
remember, you want an intergenerational mix.
Yes.
Because what I need to let us know, let you be reminded of, this is the first time in the world that we have five generations alive at the same time. Because
Wow.
life expectancy is long.
Yes.
Average age now is 78 for men and 81 for women. Average. In Trinidad and Tobago, we have almost 200 centenarians. The eldest leader had
Wow.
12. So what do you do with that? You don't just leave them in a corner.
Yeah.
Plus, as you get older, and this is important to note, as you cross 80 to 85 and above, your long-term memory is sharper than your short-term. So you may not be able to remember what you ate for breakfast, but you can give in graphic detail what you did at school, who were your
Yeah.
schoolmates. Now, that is the foundation of what a griot is. I used the term the other day, and students didn't know what a griot is. It's like a storyteller.
Yes.
That is one way, again, of utilizing this resource. Don't see the seniors as a burden,
That's
because they
right.
can go to the early childhood and let them sit socially distant around this griot, and like Louise Bennett, and you speak to them on oral history, the folklore.
Yes.
So you engage in both groups. But if
Yes.
you lock granny and grandpa in a room,
Up in a room. That's
complete
right.
with a mask, and then all the scene of you is your eyes up,
Mm-hmm.
how are you going to bridge that gap?
That's
They will
right.
start going more and more internal and inside, and just saying what is going on, and people may be serving them in gloves. They don't want to touch anything, not knowing they're trying to save their lives.
Yeah.
But this is remember, this is unprecedented for any of us, in the world.
Yes.
This can't be the new world, but it is a pandemic, that it is a virus that we certainly have to live with.
Yeah.
So here is where we're coming up with innovative things. One of the
Yes.
things that could be done, you see, early morning sun
Mm-hmm.
between 6:30, because it rises nearly like 7 o'clock.
Yeah.
Between 7 and 9, let granny and grandpa go outside, walk around the house.
Yes.
Early morning sun, that's the sun that activates the melanin in the skin with the sebaceous glands, and the body starts to manufacture, it activates the manufacture of vitamin D. And that vitamin D is the one that is needed to boost your immune system. Because what we are seeing is, because remember, the highest rate of mortality is among the seniors now.
Mm-hmm.
And before, when they are sent in the ICU and the HDU, they go through a whole depression and loneliness that we can't even put into words. Some of
Right.
the health providers are trying to tell us what they go through, and they break down, because they're even trying to show pictures of their faces on their
Yes.
uniform so that they can still see people, but they are not seeing their
Understand.
relatives.
Yes.
So depression could be a precursor.
Yes.
Keeping them isolated in a room. You know it is for their good, but they don't know why you are treating them this way.
Yeah.
So because remember, not many households have the ability to socially distance inside the living room.
That's right.
Can't keep 6 feet away with granny there, so she may have to be in her room, but maybe keep the door open so that she's not locked away. Even
Yes.
watching a TV is good, yes, but they are not TV peons. They like conversation,
An interaction, yes.
interaction. You
So
see?
Dr. Definitely, these have been some really, really awesome tips that
And
you've
I'm
given
saying
us.
this, and I'm
Um,
saying it just rolling it out like conversation, but this is alarming for a lot of people, eh?
yes,
Because and I asked some of the students, I said, how many of you chat with your granny? No answer, or
yes,
grandpa. Now,
yes.
because they take up in the coursework or linemen or wired, and they forget. They
Yeah.
didn't notice that the grandparent didn't even eat the breakfast.
And it does happen. So, I think for me, the great takeaway is really understanding that the elderly have a perspective that if you're not in that position, you may not understand. And I really hope those who are in the viewing audience can appreciate the information. As a matter of fact, I know that they're going to be able to appreciate because you've even opened up my eyes as I'm listening to you and I'm reflecting on my own grandma who passed some years ago. But
Yes.
this conversation really helped to bring some more things into perspective as I reflect on us. So I really appreciate you for joining
Because
in and
again,
chatting.
they are holders of history.
Yes,
Remember, both the Afro and the Indo races came out of oral tradition.
that is
So
right.
we didn't know all we know from in a book. It was told
Yes,
to us, and we
that
have
is
to
correct.
respect them. We have to give them that respect and dignity
Yes,
because they still have the mental acuity, the majority of them. And I will say this: do not say once a man, twice a child. They are not
hmm,
children. I
yes,
think that is what ticks some of them. They treat them like, you hear me? You understand what I'm saying? No, no, no. They are fully aware. If even you have to feed them, they're not children still. So don't
yeah,
mix two kinds of dependency because
yes,
you just have to go at their feet and sit and chat.
yes,
And you
yes,
hear all the wisdom and all the
yes,
history because of engaging them.
yeah.
Those are preventative. And I like the approach you took in your questions. You didn't just harp on what is the mental illness. What I
Yeah.
liked is you looked at what we can do to prevent
Yes,
it.
because we want to empower people to be able to
Precisely.
do better. And information empowers us to be
Precisely.
better and to do better. So, once again, Dr. Rouse, thank you so much
You're most
for
welcome.
joining us today. And we really want to appreciate the viewing audience for joining in to the Caribbean Parenting Digital Public Education Series. This was in the last fourth day of official booked discussions that we had, and we trust that you'd be able to use all of the information. The info is going to continue to be streamed and be available digitally, so we encourage you, if you missed any of our earlier conversations, feel free to go check it out, because for today we chatted about mental health and children. That was awesome. We chatted about mental health and teens. We touched on mental health among adults. And here we're now wrapping up mental health and the elderly. Thank you so much for joining us as we engage in discussions about World Mental Health Day, and we trust that you're going to be now empowered to do better and be better. So until then, my name is Alina Lewis, and this has been the Public Education Series at the Caribbean Parenting Digital Show.